The state of Michigan is aiming to ban seclusion and restraints at juvenile justice facilities and at other institutions caring for children unless circumstances are life-threatening. The change is a response to the death of 16-year-old Cornelius Fredericks, who went into cardiac arrest on April 29th last year after being restrained by staff at Lakeside Academy in Kalamazoo.
It became clear to us that we needed to limit the use of restraints. Restraints are extremely unsafe.
It's been almost a year since the death of Cornelius Fredericks.
What we got right away was that we have a youth being taken to the hospital after a restraint at the facility, and it doesn't look good, is what they said to me.
2 days later, Cornelius died.
Cornelius was, he was a good kid. I mean, he definitely went through trauma and things that no one could even fathom. He was goofy, he loved music, he loved chess, he loved technology. He really was smart in ways that a lot of schools and things don't label as smart. He was tough. He definitely had moments that he would push your buttons. You know, he pushed my buttons, he pushed other students' buttons. But that was really just his defense, considering everything he had to go through and being part of the system. I mean, you kind of have to put up some of those fronts.
His death made the state take a closer look at its policies.
After Cornelius's death, we issued emergency rules, which limited the use of restraints on a temporary basis.
Stacy Bladen is the interim executive director for the Children's Services Agency at the Michigan Department of Health and Human Services.
Restraint use will still occur, but there will be significant limits on restraint use. We were running roughly 600 restraints per month before Cornelius died. And that was right after he died.
Bladen says now they're down to 272.
Restraints are still being used. We're trying to limit restraints. The time of restraints, it has to be a serious, that the child is at imminent risk, serious injury to himself or herself or someone else. So we've put limits on the use of restraints, and we can see them going down.
When we hear the word restraints, most people think about tying people down, putting someone in handcuffs, but it can be also chemical restraints, improper use of medication to subdue someone because of their behavior.
Restraints are difficult. I mean, there were absolutely, I can recall times where to keep staff and students safe, that kind of had to be done. But I also believe that there is a line. I don't, feel that taking a student to the ground and using the restraints that were used that day are ever appropriate.
Debbie Plotnick is the Vice President for State and Federal Advocacy at Mental Health America, a nonprofit that addresses the needs of those living with mental illness and that strongly supports getting rid of the use of restraints and seclusion.
Seclusion and restraint really is akin to torture. There's no nice way to say it. Holding someone down, tying them up, putting them in what amounts to solitary confinement is torture. It is akin to torture, and it is traumatized. And Mental Health America feels very strongly that seclusion and restraint especially should not be used when it comes to youth. It is something that stays with them and really creates a lifelong trauma.
But if the state gets rid of restraints, what will be used instead?
Kids do have violent outbursts, and they're not able to regulate and control their behavior all of the time. So what do we do? So there is we call 6 core strategies.
Bladen says it's a training curriculum that focuses on alternatives to the use of restraints and seclusion.
It includes things like workforce development, training, coaching, mentoring staff on prevention and intervention skills to avoid power struggles and de-escalating youth. This is not about watching a youth about to lash out and get violent and then start to de-escalating them by talking to them. This is backing up much earlier.
Like when a youth is admitted, having a conversation with them and their family about what triggers them and what calms them down.
What are things that we can do, and what things should we be looking for doing to include in your treatment plan or to include in your environment that will help you. And those seem like very simple things, but they're very effective.
She says this is not something that you can simply stand up and put in place. It takes time.
After you've eliminated restraints, it is not as easy as a light switch going on and off. It is significant organizational change. And so we know from talking to partners across the nation that this could take 2-3 years to fully implement successfully and sustain.
One state that has success doing this is Pennsylvania.
Really started to phase out seclusion and restraint throughout their whole mental health system, especially in their state hospital systems, and brought it down to very, very few instances in a year where seclusion and restraint was used.
Bladen says public hearings for revised child care institution licensing rules are scheduled for June. The revised rules would prohibit chemical restraints, pressure point control, and pain adherence techniques, use of straitjackets, hog tying, and restraint chairs. It will also prohibit restraining children to objects like beds or walls, using restraints for punishment or discipline, and also peer-on-peer discipline. The state hopes to have the rules changed by May 2022.
We lost a kid to something senseless, but really, in all, what Cornelius would want is, like I said, to make sure that no one else has to go through this. He would want his name to make change.
Reporting in Lansing, I'm Tiana Jenkins.